If you're an athlete, a coach, or, just someone who's ever stepped off a curb the wrong way, that pain of an ankle injury?
Oh, yeah.
They're just so common. I mean, we're talking something like 3 million ankle sprains a year in the U.S. alone.
And in sports, it's a huge chunk of injuries, about 15% for high school and college athletes.
Which is exactly why the need for quick, effective prevention is so critical.
And we really understand the mechanics behind it. The two big risk factors are limited ankle dorsiflexion.
So how far you can pull your toes up toward your shin.
Exactly. That and weakness in your calf muscles, your plantar flexors. If you have those two things going on, your injury risk just skyrockets.
Especially later in a game, right, when fatigue sets in.
That's the crucial time. So the question becomes, is there a rapid intervention, something that can boost strength and flexibility right now before an athlete even steps on the court?
And that search for a quick fix is why we're doing this deep dive into a technique called tissue flossing.
Yeah, this idea that a simple elastic band can be a shortcut to better performance and maybe even prevention.
That's the big question we're tackling today. And we're going to do it by analyzing a really rigorous, controlled study that looked at the immediate effects of this very technique.
Right. So for those of you who want to go straight to the source, the whole discussion today is built around one article.
It's called Immediate Effects of Calf Tissue Flossing on Ankle Joint Torque and Dorsiflexion Range of Motion in Healthy Individuals, a randomized controlled crossover trial.
It was led by Yuto Sano, Masashi Kawabata, and their colleagues.
And you can find it in the Journal of Sports Science and Medicine, published just this year, 2024.
So our mission really is to break down what this trial found. Did applying these floss bands at low or high pressure actually change ankle strength or flexibility right away?
We're looking for the real clinical value behind what seems like a quick fix.
And to really get why this research is so urgent, you have to understand the long-term cost of just one ankle sprain.
It's not just that you might roll it again.
Not at all. The re-injury rate is incredibly high, but the truly shocking stat is that up to 70% of athletes who sprain their ankle develop chronic ankle instability.
70%,
Yeah.
that's a massive number.
It is. It means this isn't a temporary setback. For many, it becomes a career-long battle with an unstable joint.
So trainers can't just, tape it up and hope for the best.
Exactly. And performance suffers most when stability is needed most, when an athlete is exhausted. So finding a quick way to address those key risk factors, the flexibility and strength right for or even during a game is just crucial.
Okay, so that brings us to the technique itself. What exactly is tissue flossing?
It's basically a targeted, very temporary compression. You take an elastic latex band, the floss band, and wrap it tightly around a muscle group, like the calf.
And it's on for a very short time.
Super short, usually just 1 to 3 minutes. And while it's compressed, the person is actively moving the joint.
And the appeal is just,
Yeah.
It's so obvious. It's simple, it's fast, you can do it in a warm-up, you can do it at halftime.
And the proposed mechanism is where the science gets really interesting. The compression is much higher than what you see in, say, blood flow restriction therapy.
So it's not just about cutting off blood flow.
No, the theory is that the pressure works on the soft tissue itself. It's thought to increase something called fascia gliding and change the tissue's viscoelasticity.
Okay, hold on. Viscoelasticity. For those of us who aren't physiologists, what is the floss band actually changing inside the muscle?
Okay, good question. Think of viscoelasticity as like how sticky or pliable the tissue is. Healthy tissue is smooth.
Right.
And fascia gliding is just the ability of all those different layers of muscle and connective tissue to slide cleanly over each other.
And when you get tight, they sort of stick together.
Exactly. So by applying that high compression and then moving the joint, you're squeezing out that stickiness.
And then when you take the band off.
A sudden rush of blood comes back in reperfusion, which helps reorganize that less restricted tissue. The hope is it allows for better movement and a stronger contraction.
Like a quick reset for the whole system.
That's a great way to put it. So let's look at how Sano and his team actually tested this.
This was the randomized controlled crossover trial.
Yeah, which is a powerful design. They had 19 healthy young men, all university soccer or basketball players, and each one served as their own control.
So everyone experienced every condition.
And the intervention itself was incredibly brief.
Just 2 minutes, you said?
Only 2 minutes, applied to their non-dominant calf. And they had a washout period of 5 to 10 days between sessions to make sure there were no lingering effects.
The real variable they were testing was pressure, right?
Yeah, that's right. They had 3 conditions. First, a control, which was just a basic underrep with almost no pressure.
Right.
Then a low pressure band, averaging about 138 millimeters of mercury.
And the high pressure.
That one averaged about 163.
And it's important to remember they weren't just sitting there. They were actively contracting their muscles.
Correct. During those 2 minutes, they did 6 maximal isometric contractions, pushing as hard as they could at 3 different ankle angles.
What really stands out to me in the method is the focus on safety. I mean, with that much pressure, you have to be careful.
Absolutely crucial. They had a sensor monitoring pressure continuously, but the really smart thing they did was use ultrasound.
To look at the artery.
Yeah, to watch the posterior tibial artery and make sure they never caused complete arterial occlusion, a full blockage.
Because that's the danger zone.
Right. Other research has flagged pressures around 200 millimeters of mercury as potentially causing, numbness or severe pain. This study made sure to stay safely below that.
And the outcomes were measured with some serious hardware. An isokinetic dynamometer for strength and the weight-bearing lunge test for flexibility.
Right. Very precise. So let's get to the first big finding. Ankle strength or plantar flexion torque.
This is where it gets really, really interesting. Did the bands actually make them stronger?
They did, but, and this is a huge but, it was only significant in one very specific position.
Which was?
When the ankle was stretched in 10 degrees of dorsiflexion, they found no significant strength gains when the ankle was neutral or pointing downwards.
So only in that stretched position. Quantitatively, what was the boost?
Okay, so the low pressure band gave them an extra 4.3 newton meters of torque. The high pressure was a little more at 4.9.
I mean, 4.9 newton meters.
Yeah.
Sounds kind of small. Is that actually a meaningful difference for an athlete?
That is a sharp question, and it forces you to look at the most important detail. On its own, no, a 4.9 boost isn't game-changing for a rested athlete. But look at the control group. The athletes who did the same exercises without the floss band, they actually saw their strength decrease by 5%.
Wait, they got weaker just from doing the test.
Exactly. That's fatigue. The
Yeah.
testing protocol itself tired them out.
So the flossing conditions didn't so much make them stronger as they stopped them from getting weaker.
Precisely. The real benefit here isn't a massive boost to a fresh muscle. It's mitigating that performance collapse you expect to see during intense activity. They kept the strength from dropping off.
That completely reframes the benefit. And the low-pressure band worked just as well as the high-pressure one for that.
It did, which suggests you don't need to go to extreme pressures to get this fatigue mitigation effect.
And why do you think it only worked in that one stretched position?
Well, the researchers have a great hypothesis. At 10 degrees of dorsiflexion, the calf muscles are under maximum tension.
Okay.
That's where any fascial restrictions or stiffness are most pronounced.
So the flossing works best right where the problem is the biggest.
You got it. The compression and movement likely improved that fascia gliding right where it was most needed, allowing for a stronger contraction when the muscle was most vulnerable.
A very targeted effect.
And just quickly, they saw no change in the muscles on the front of the shin, the dorsiflexors. But that makes sense. They're smaller and weren't the target of the caftan.
Okay, so we know flossing helps maintain strength and fight off fatigue, which is fantastic. But what about flexibility? What did it do for their range of motion?
Well, both flossing conditions did produce a statistically significant improvement in ankle dorsiflexion range of motion compared to the control group.
So it worked.
Statistically, yes. The control group barely changed at all.
Okay, so what were the numbers on that improvement?
The low pressure band gave them an increase of 1.7 degrees.
And the high pressure?
A little less, actually, 1.3 degrees. So on paper, the technique does affect flexibility.
But, I sense a but coming. Is 1.7 degrees enough to matter in the real world?
And that is the vital distinction for you, the learner, to make. The difference between statistical significance and actual clinical relevance.
Right.
The study's authors concluded that despite being statistically real, the clinical effect was negligible.
Why? What's the threshold?
It's something called the minimum detectable change, or MDC. For this specific test, the MDC is 4.7 degrees.
So anything less than 4.7 degrees is basically within the noise. You can't be sure it's a real functional improvement.
A perfect way to put it. So while the band is definitely doing something to the tissue's viscoelasticity, it's not enough to unlock a functionally useful amount of flexibility, at least not with this specific 2-minute protocol.
That's a huge takeaway.
Mm.
In this context, it's a strength maintenance tool, not an immediate flexibility tool.
Exactly. And to circle back to safety for a moment, this study confirms that the pressures they used around 138 and 163 were safe. They didn't cause arterial occlusion, which is great clinical data supporting their use below that dangerous 200 millimole in G mark.
So this whole deep dive really boils down to one critical clinical takeaway for trainers and athletes.
Yeah, I think if we connect all the dots, the main implication is clear. A brief 2-minute session of calf flossing can immediately help mitigate the drop in strength that happens with fatigue.
Especially when the muscle is stretched.
Yes. And it does this without hurting your flexibility or causing any negative side effects.
And if you compare flossing to other things people do before activity, like foam rolling,
Well, that's interesting. Some recent meta-analyses have suggested foam rolling might not actually give you a significant boost in isometric strength. So tissue flossing might offer a unique benefit there.
and again, you can't overstate the practicality. The speed and simplicity mean it's easy to add to any routine.
Absolutely. It gives athletes an edge right when they need to fight off that fatigue.
But to be thorough, we have to talk about the study's limitations. Where should we be cautious about applying these findings?
That's key. There are a few important points. First, the population. This was only done on young, healthy, male university athletes.
So we don't know if it would work the same for women or older people or even elite pro athletes.
Exactly. Their muscle mass, their body fat, it could all change the outcome. We need more research.
What about the intervention itself?
Well, they only did isometric contractions. The researchers themselves point out that if they had included calf stretching with the flossing, which is common in practice,
They might have seen a bigger flexibility gain.
it's very possible, maybe even a clinically relevant one. Then there's the fatigue issue. The order of measurements wasn't randomized, and the rest periods were short.
So the design itself might have made the control group even more tired than they would have been naturally.
It's a possibility. And the last big question, the one every athlete wants to know.
How long does it last?
We have no idea. This study only measured the immediate effects, like minutes after taking the band off. The long-term benefits, the actual injury prevention potential over a season, totally unknown.
So let's synthesize this all. Calf tissue flossing, when it's applied briefly and safely, seems to be a really valuable pre-activity tool. Its main immediate benefit is maintaining ankle strength when the muscle is stretched and fighting off fatigue. That's a real measurable advantage in a high-demand situation.
So since we know flossing seems to work by immediately counteracting that performance drop we see with fatigue, the big question for the future is this. What happens if you use this consistently? If you integrate this quick technique into training, season after season, how might that repeated mitigation of fatigue actually impact the rates of chronic ankle instability in high-risk sports like soccer and basketball?
That's the real-world outcome we need to chase.
That's the million-dollar question.
If you found these precise results as fascinating as we did, we really encourage you to read the full article by Sano and his colleagues. You can get into all the technical details there.
Because knowledge is always most valuable when it's understood and applied critically.
And of course, don't forget to follow the channel and turn on your notifications for more deep dives into specialized research. We will catch you next time.